Go.
All right. Hi, Leslie.
Hi.
Hi, I'm Connor Shoburn. I'll be your student physical therapist assistant for today. So, Leslie, I see that you're coming in with right lateral epicondylitis.
Correct.
Did your doctor ever kind of explain what that is?
Not really.
Maybe you referenced it as tennis elbow?
Oh, yeah.
So just to kind of get into the actual name of it, lateral epicondylitis is pretty much just inflammation of the tendon that attaches your wrist extensors, the muscles that do this motion. It's just inflammation that typically is originated there, which kind of goes across the forearm and kind of goes until about there. And over here is your lateral epicondylitis, so that's kind of where the name comes in from.
Mm-hmm.
So obviously it's a gradual process, so it's just really due to overuse of the wrist extensors and stuff like that. So nothing that you did in particular, just wear and tear issue. So Leslie, are you currently having any kind of pain with that epicondylitis?
Just a little pain in my elbow occasionally.
Just pain in the elbow? On a scale of 1 to 10, 1 being like absolutely nothing, and then 10 being like the worst pain you've ever had in your life, can you kind of explain what that is?
5.
About a 5? Is that at rest, or is that whenever you're actually active?
Probably more so when I'm active.
And then what about whenever you're just at rest?
Probably 2.
2. So with that pain, is there any specific spots that you can kind of feel it whenever it starts flaring up?
Not really.
And then is there any motions that you do that typically cause that pain? Like
Not any in particular, no.
movements. And then could you kind of explain, like, is that pain a sharp pain, dull?
It's kind of a more dull ache.
Now, is that for at rest and active, or?
Yes.
And then, I know since of that pain, typically if you're active, it flares up a little bit, which is completely normal. Does that mess with your activities of daily life, which could be cooking, any kind of self-care like brushing your hair or using the blow dryer or anything like that?
More so just with picking up heavy stuff.
Picking up heavy stuff? Okay. And then are you currently taking any kind of medication for that pain?
No, just aspirin when needed, Tylenol.
Tylenol. Do you know exactly the dosage?
Extra strength?
Okay. Over the counter?
Yes.
Okay. And then Leslie, are you currently having any kind of sensation loss in about anywhere in this area? Like, can you tell the difference between hot and cold, dull and sharp?
Mm-hmm.
Okay. No loss. And then, do you have any kind of personal history with cancer? Like just being just you, not any kind of family.
Yes.
So you do have a history of cancer. Are you currently in remission, or
Yes.
by how many years?
5.
Okay. And then do you currently have any kind of circulation issues, such as high blood pressure, hardening of the arteries, blood clots, anything like that?
Just high blood pressure.
Is that controlled by medication?
Mm-hmm.
Okay. And then do you have any kind of cardiac issues, such as missed palpations or anything like that?
No.
And then, do you have any current flare-up of pain?
No.
And then, are you having any kind of fever or anything like that currently?
No.
And then, since the last time that you came in, have you had any kind of change in your medical history?
No, none.
And then, are you possibly pregnant by any means?
No.
And then, are you allergic to any kind of topical ointments?
No, not that I know of.
All right, last one. So this last question will kind of run into my explanation. So today we're going to be doing some friction massage on this area of your forearm. This is just overall to break up any kind of nodules or any kind of trigger points that we have in that forearm, and overall just kind of increase tissue mobility. So with this, we could end up seeing a little bit of increased circulation. And this just to the forearm, so it shouldn't be a big deal. But if you have any kind of bad menstruation, this may increase any kind of flow that you may have. So are you fine with that?
Mm-hmm.
Okay. I just want to make sure that it's not too bad and we don't make it any worse by any means. All right, so we're going to go ahead and continue with our friction massage. So first thing I'm going to do is just some effleurage strokes. So I'm going to be using just a little bit of ointment here just because we don't have any cocoa butter at the moment. So with friction massage, you may feel a little bit of discomfort just because it's not going to be nice and smooth and gliding over the skin. So a little bit of discomfort is completely normal, but just make sure there isn't any kind of pain. So I want you to go ahead and take a nice big deep breath in and release. So just to kind of warm up the area, just going to be spreading out the lotion. So this is just pure effleurage stroking. All right. Go ahead and grab a little bit more. All right. So kind of get a little bit deeper in the area, just to see if I can't feel any certain trigger points. Feel anything so far?
No, no pain.
Not running over anything?
Mm-mm.
I think there's one right about here. So I'm going to go ahead and apply just a little bit of static pressure here. I'm going to be here for about 20 seconds. So just kind of allow it to release a little bit. Just going to chill right here. So is that static okay, or would you prefer some kind of circular motions?
No, that's fine.
Okay. All right, and then, so after holding that for about 20 seconds, we're gonna kind of effleurage or clear that area out so we don't have any kind of buildup of any kind of toxins in that area. Just kind of flush them out a little bit better. Feels a little ropey right up in here. So this next one I'm gonna do is just some horizontal stripping. So I'm just gonna go a little bit deeper into that muscle and just kind of spread it apart, hopefully breaking up any kind of adhesions we may have. You feeling okay so far?
Mm-hmm.
Okay. massage that area out, clear it of any kind of toxins, go back over. Not feeling any kind of trigger points or anything?
No.
Feeling a little bit of ropiness right up in here. So I'm going to go ahead and go into a little bit of stripping. So I'm just going to be pulling in the direction that's a little bit tighter. Again, it's just to kind of release any kind of adhesions we may have. How's that pressure feeling so far?
Oh, it's fine.
Okay. No pain?
No.
All right. Just kind of flush that area out. Go back over, try to see if I can't find any more little rough spots here. So these treatments typically last about 5 minutes long, so they don't last too long here. Got a little bit of roughness up in here. So I'm gonna kind of go back in and just do a little bit of strumming work, just kind of getting in between those muscle strands, really try to break them up a little bit and release. That pressure okay?
Mm-hmm.
All right. So I'm gonna go back into effleurage stroking, just kind of loose or going a little bit lighter now since we're ending the treatment. All right, that's all we had. You want me to wipe off your arm or?
Oh, no. I'm good.
All right.
All right. Thank you.
Of course. So Leslie, that is all we have time for today. Again, this is to really just break up any kind of nodules or trigger points we may have had in that muscle and overall increase any kind of tissue mobility. So hopefully we're able to achieve that. I think we did. Those nodule points tended to be a little bit loosened up, so I think we achieved exactly what we wanted. Do you have any kind of questions for me at all?
Nope, I don't think so.
All right, and then would you happen to know exactly when you'd be coming in next?
Probably about a week maybe?
So actually, I'll have you coming in on Monday.
Okay.
At about 3 p.m.
Okay, that'll work.
All right, Leslie, if you don't have any more questions for me, that's all we have for you tonight.
All right, thank you.
Thank you very much.
Bye.